So I'm hoping that some of my technology videos and stuff will work today. So we'll see. So thank you so much for joining us for Take Action: How to Nourish Your Healthy Communities. I'm Isabel Hinton, and I am a health educator with Bronson Community Health, and I am super excited that you guys are here. A couple of housekeeping things before we start. If you guys have been in our classes before, this is being recorded, so if you want your cameras on or off, that is totally up to you, but know that it is being recorded. We do offer closed captioning, so if you need closed captioning, you can click the CC button. No, it's not 100% accurate, but we hope it tries its best to be 100% accurate. So if anything comes across and it's confusing, feel free to type something in the chat and we will clear that up as well. Just a couple of things. If you can stay muted unless we're doing a discussion, just to kind of reduce the background noise, that would be great. And then we can, of course, feel free to keep your videos on or off, totally up to you. Couple of services and care at Bronson. If you need to find a doctor or search for a specialist, you can do so by going to our website, bronsonhealth.com, or call a care advisor. The number is on the screen. You can get some help with my charts, calling Bronson Health Answers. They are able to help you, or you can send them an email. If you need help finding prices for Bronson services, that's going to be the price verification department. That number is also on the screen. And then finally, for payments or patient and payment billing help, feel free to call Bronson Patient Accounting. Number is right there as well. So welcome, and I hope you guys enjoy today's class. So today we are going to be discussing what the purpose behind National Public Health Week is, and that is actually this week. So we're Thursday, but honestly, everything we're going to be talking about in this presentation today, you do not have to do just around National Public Health Week. You can do that at any time that you would like. So if you want to do it next week or the week after, that's totally fine. We're also going to be learning a little bit about the social determinants of health and how health is more than just a personal choice. We're going to be learning about 7 themes and some practical ways that you can help address those needs to make your community a little bit healthier. And then you'll leave with a list of resources to help you on your journey as being a crucial part of healthy communities, because all of us know that it takes all of us to create a healthy community. So with that being said, I would like to know from you guys, feel free, I mean, we have a pretty small class right now, so feel free to unmute yourself if you feel comfortable in doing so, or you can type in the chat if you feel comfortable doing that. What do the words healthy community mean to you? Feel free to unmute or type it in the chat. Or even if you don't know, that's totally okay too. This is all just opinion based. I'm just curious. All right, and if nobody wants to share, that is totally okay too. I'm never going to make you guys share if you don't want to, but if you're still thinking on this question and you want to think about it a little bit longer, feel free to type your answer in the chat whenever feels right for you. So
yeah, I'm still thinking.
Okay,
a lot of things are coming to my mind, but how do I describe
it?
Yeah.
Myself, I think a healthy community is helping those that are not able to help others or being able to help themselves. So by giving any type of food or whatever to the food banks and that type of thing, I guess that's what you're referring to.
Okay, thank you, Virginia, for sharing. All right. So then if you are still thinking, and let me know if I'm mispronouncing, is it Ravathi? I want to make sure I'm pronouncing that correctly.
Yeah, that's correct.
Okay,
so,
perfect.
Yeah, so I'm thinking healthy community is where people are supporting each other in whatever way is needed, not just individuals' health, but also thinking about the community.
Yeah, That is great. Thank you so much. I appreciate that so much, Virginia and Rebecca. And then Joyce and Gail, if you think of anything, feel free to type in the chat or unmute yourself as well. This is a totally up to you. If you feel like, kind of communicating, discussing, that's totally up to you. I'm never going to make you uncomfortable if you do not want to share. So with that being said, we will dive in to some of our content. So what is National Public Health Week? So this is kind of a lot on the screen, but this was the actual definition from the National Public Health Week, American Public Health Association. So during the first full week of April each year, American Public Health Association brings together communities across the United States to observe National Public Health Week as a time to recognize the contributions of public health, shed light on issues or highlight issues that are important to improving our nation's health. Every year, the association develops a national campaign to educate the public, policymakers, and practitioners about issues related to each year's theme. APHA creates new NPHW materials each year that can be used during and after National Public Health Week to raise awareness about public health and prevention. So that was a lot. So we are going to dissect that a little bit as we move through the presentation. Okay. So the first thing that I want to talk about is the social determinants of health. So just out of curiosity, you can just raise your hand or you can type in the chat or you can unmute yourself. Does anybody know what the social determinants of health are or have ever heard of the social? And then Joyce, I think I'm going to mute you unless you were going to say something, just because I heard a little bit of background noise. So unless you want to mention something. Okay. All right. No worries, because I am going to share with you all what the social determinants of health are. So the Office of Disease Prevention and Health Promotion defines the social determinants of health as conditions in the environments where people live, where they are born, where they learn, where they work, where they play, where they worship, and where they age that affect a wide range of health, functioning, and quality of life outcomes and risks. So the social determinants of health, according to Office of Disease Prevention and Health Promotion, social determinants of health can be grouped into 5 areas or 5 domains: economic stability, education access and quality, healthcare access and quality, neighborhood and the built environment, and the social and community context. So what contributes to health? So this graphic here is kind of an interesting graphic because you can see here that only about 20% of people's health outcomes are affected by health, and the other 80% are determined by other factors. So if you can see in this graphic, you can see all the different factors that can contribute to a person's health. We've got socioeconomic factors such as education, job status, family support, income. We've got the physical environment such as housing and neighborhoods. We've got health behaviors, diet and exercise, tobacco use, alcohol use, sexual activity, and then we have healthcare as 20%. So we are going to watch a quick little video that was from the University of Michigan, if it works. I'm hoping that it works because it's a really great video that talks about the social determinants of health and what they are and kind of defines it. So I'm going to actually stop sharing my screen for a second because I need to reshare so you guys can hear the sound. So let's try this. See if this will work. I'm hoping that it does. Let's see. Okay. So if I go here, we're going to try this. We're going to see if this works. Hopefully it does. Share sound. Okay. Slide. Come on. Oh, come on. Oh no. Here we go. See if this will show up. All right, it's loading. So can you guys hear this? you guys hear that when it was playing?
Yes.
Okay, perfect.
Yes.
Thank you. Okay, so that was just a short little video kind of explaining what it is. So as you can see from the video, that the social determinants of health can provide protective or harmful factors. And so these factors can overall impact someone's health positively or differently. So my social determinants of health do not look like yours or the person sitting next to me or the person in a different county than me. So if person A grew up in a county with the best healthcare, that was ranked highest in the most active communities, had many high quality grocery stores and healthcare places, person A will have the opportunity to have a healthier lifestyle than person B, who might have grown up in an area that has subpar healthcare or no healthcare, no safe places to be active, no grocery stores, etc. So the social determinants of health affects everyone overall. Now, everything that goes into health can be made easier or harder depending on the social determinants of health. So if you're thinking about it, thinking about the person who has to work 2 jobs and has to make it to appointments but can't because there's barriers in transportation or scheduling, or someone who has access to just a dollar store and doesn't have any access to fruits or vegetables or any of those things. So how, can they add more fruits and vegetables to the diet? So all these things can really and do impact health. So what can we do? Healthy communities requires an all hands on deck approach. So this means, like we were talking about in the beginning, that everybody in the community can play a part in making the community a little bit healthier. So the first thing I want to talk about is thinking about our inside pods versus our outside pods. So what can you do as a community member to improve the health of the community with the people that are in your inner pod or the people that are closest to you? And then also thinking about what you can do as a community member to help improve the health of the community with people that are in your outer pod or people that, are, members of the community. So a couple of different things to just kind of help get you thinking about this. So one of the things is getting to know people who are different from you. So inviting them into your inner pod, whether that's a book club or wherever it might be, and then learning from them and their lived experiences. Speaking with people in your inner pod about things going on that might help with health outcomes. Maybe someone in your inner pod might know about some things that are happening in one of their other inner pods, right? Using your knowledge to help people close to you gain access to resources such as affordable medical, dental, and mental health care services, insurance services like Medicare or Medicaid enrollments, transportation services, or housing, food, and education. And that actually falls into both, right? So you can also invite people, that are community members that you might overhear at the grocery store or the doctor's office, wherever you might be, and help. And if you know where some of these services are or resources are, helping these people gain access, right? Asking your church or another group that you might be involved with there, or start your own group or organization and invite people to join you to maintain social connectedness. So we know that social connectedness is really important when it comes to health outcomes. And actually, during the start of the pandemic, sounds crazy, that was like a long time ago, it seems like, but also not that long ago. Anybody else feel that way, that they're kind of like in this weird, like, oh, the pandemic's still going on, but also it was started a long time ago and it's still around, but it just seems like things are sort of back to normal, but not really. I don't know if anybody else feels that way.
I think it'll be here for a long time.
Oh yeah, I don't think it's ever going away. I think forever, it's forever going to be a part of our daily lives. But it's just interesting to think about how so many things have changed over the past 3 years. I mean, even over the past 3 years, we weren't even delivering the virtual education, right? So it's really interesting, all the things that have changed. But anyway, so during the start of the pandemic, there was actually a specific intervention that addressed one of the needs highlighted in the community health needs assessment. If you don't know about that, it's Bronson's community health needs assessment. I highly recommend you take a look at it. I actually have the link at the end of this presentation. And it basically, in this time at the start of the pandemic, local organizations had volunteers connect with other community members as just a local check-in program to help maintain social connection. So it wasn't even, there were people that we were offering like resources and food access and all that other stuff, but there was actually a program that specifically had volunteers, all other people in the community, just to maintain that social connection. And this was really cool because we know that social connection is really important for health outcomes. It has really strong links to longevity and overall well-being and wellness. So connecting with other community members is a really great way to maintain social connection as well. And you can do this in both your inner and outer pod as well. Now, when we're also thinking outside of our pods, thinking about civic engagement. So civic engagement is really good for public health because people who are more engaged civically makes for higher public health outcomes. So when people hear things that they know that are going on that help with health outcomes, they can help engage people in their community or local elected officials and state officials, et cetera, to help with some of these things. So some examples: advocate and supporting things that you're passionate about through voting, engaging with local electives. If you're excited about education, talking to the school board or funders. If you're passionate about community wellness and connectedness, speaking with mental health legislators. If you're excited about health in general, try serving on your city's local health board. Serving time with smaller organizations, agencies that address the specific social determinants of health needs. So those are just some simple things, few different ways that you can give back and help to improve the health of the community. So with that being said, we are going to talk about the 7 themes that National Public Health Week kind of puts out there to kind of address some of the needs that we need in the community. So the first one, taking action with helping with community-based initiatives. So like we were just talking about, connections are a huge part of community. There are lots of different ways you can positively impact and practice connectedness in the communities that you live in. So you could re-engage with your community. You can join a sports league or a fitness group or another interesting organization that supports the health of the community that you live in. You can ask questions at public health forums or public forums in general, or join community advisory boards and learning about what's going on in your community. You can partner and collaborate with organizations that have a focus on community engagement. You can coach or volunteer your time with youth sports or other programs, and you can educate yourself on what might be going on in your community, like Bronson's Community Health Needs Assessment and the Community Health Implementation Plan. So those are some things you can help with community-based initiatives. So now we're going to talk a little bit about taking action on helping with food and nutrition. So helping with food access. I can't remember who had mentioned it, but one of you had mentioned, delivering food to food pantries. That is great. So helping with food access, you can join a community garden or start your own garden and grow fruits and vegetables and then donate those to a pantry or another local organization, which also creates a space for community engagement. You can explore cultural foods, talking to people from different cultures, doing research, etc., and then donate healthy and culturally appropriate food options to food pantries to making sure that there are culturally appropriate food options in food pantries. Um, Volunteering your time at local food distribution, so sharing your talent or your time, or at food pantries or church pantries or other places that people might get food. Educate yourself and speak with others about food programs like the Supplemental Nutrition Assistance Program, or SNAP is another way it's known as, the WIC program, school meals, etc. Or if you're really interested, especially in youth food access, you can talk to me about joining the local wellness policy committee. It's really great. It's a really wonderful committee where we take community members and parents and staff and all over and basically talk about how we can improve the health of the youth and kind of make our community a healthier place. So if you're interested, feel free to send me a chat or an email. I'd be more than happy to connect you. And then you could also join food policy councils, share information that you learned there with local partners and government officials of actions that are going on across the community. So I know I just threw a lot at you, so I want to hear from you now. If you are passionate about food and nutrition at all, what is one thing related to food and nutrition that you are passionate about? We talked about maybe growing fruits and vegetables and donating to the food pantry, cooking classes, just to kind of get your brains thinking. Does anybody have something that they're passionate about in relation to food and nutrition, and how you might be able to use that to help the health of your community? Again, type in the chat or unmute, whatever's easiest.
I used to give time to the food pantry where I lived, and then I moved to Kalamazoo a couple of years ago, and I don't know where to start.
Okay, Gail, if you are interested in still helping with that, I actually have a couple of places that I can connect you with. If you're interested in doing it still, if you want to drop your email or your phone number in a private chat to me, or I can contact you after this as well. I can connect you with some more places in Kalamazoo if you're interested in helping.
Okay.
Okay, lovely.
Yes, I'm sorry. I have donated to 12 Baskets and also to the senior in Portage over here at the senior center. Also, I had worked for quite a few years with through my church, and we had also given to help with Love Incorporated, which kind of gives you an education, not only just with your nutrition, but also, helping find jobs and that type of thing too. And of course, just the local pantry down there on Portage Road is another access that I've used, but that's just a couple of them.
That's great. Thank you so much
Thank
for
you.
sharing.
Yeah, I'm passionate about helping the community as well. So I volunteer at the 12 Baskets, and sometimes I do make food and donate at the temple, and educate people about nutrition. And
Lovely. That is so great. Food is just there's so many love languages out there, and I feel like food can be a love language. You know what I mean? There's just so much connection that can happen with food.
yeah,
So
lots
that's
of
wonderful.
discussion happens around food.
Definitely. Definitely. Wonderful. Well, thank you everyone for sharing. I really appreciate it. I love hearing these things and gives me some ideas too as well. So thank you everybody for sharing. Does anybody else want to share anything else before I move? All right. Thank you. Okay, so taking action number 3. So helping with violence prevention. So if you know our world and our communities, violence is something that is plaguing our communities all over the world. So here are some ways that you can help with it in your own personal community. First, finding out if your community has a neighborhood watch program. Volunteer time and effort and for watching out for and creating a safe space for the community. Volunteering to be a victim witness assistant. In case you don't know what that is, it's basically when people experience crimes, volunteers can help this violence or this violent victim witness assistant. And they can sit with them while they might be waiting to testify, or, if there were kids that might have been, there as well, someone can come sit with the kids. Now, this is different across all the counties. So making sure you're talking with your county local officials to see, what your county offers. But that's one of the things you can do is you can volunteer to be a victim witness assistant. You could join parenting skill and family relationship programs to help promote family environments that support healthy development. Connect with community members through mentoring programs or after school programs. Reach out to local programs to learn effective strategies for preventing violence, and then connecting community members with mental health services. You can also, this is very simple, is promoting respect and empathy with friends, family, peers, and strangers. Never know what's going on in anybody else's life. And so, kind of promoting respect and empathy is a great way to make people feel seen. You can also dig into resources and strategies that can help reduce violence in the community, such as through the community violence prevention, intervention, and suppression model. So these are all some strategies from childwelfare.gov and the CDC. You can explore resources that are available at the U.S. Department of Health and Human Services, Admin for Children and Families, or through the National Center for Prevention of Community Violence for community-based resource solutions for people of all ages. So there are lots of different places, and we can dig into resources and strategies to kind of help reduce that violence in the community. So that's another way that we can take action to try and support the health of our community. Moving on to taking action number 4. So helping with mental health efforts and connectedness. So mental health has been a very thought about thing that's been going on, because it's good that people are kind of being more open about it. So mental health is something that is a concern for our whole country, honestly. And mental health is extremely important and can impact a community's overall well-being. So by learning more about mental health and how it can affect a physical and social well-being, and how people think and how they feel and how they act or why they act the way they act, is one way to kind of improve the health of the community. So some things we can do to help with this. All of these really great ideas and resources, are coming from lots of different accredited agencies. So we've got, the CDC, we've got the American Public Health Association, we've got the childwelfare.gov that I was talking about. We have so many other ideas and places where mental health, where these things are coming from. So those resources are going to be at the end of this presentation. So to directly help with mental health efforts and connectedness, you could volunteer at mental health organizations. You can learn about and get educated on suicide prevention and intervention, exploring resources and toolkits. There are tons of opportunities available to explore these resources and toolkits at the National Alliance on Mental Health, U.S. Department of Health and Human Services, National Institute of Mental Health. And you can look at all of these places to help friends, family, community members, peers who might be struggling. And connecting people who are struggling with the Substance Abuse and Mental Health Service Admin National Helpline That number is 1-800-662-HELP, or connect with a trained counselor through the National Suicide Prevention Lifeline. So those, in case you know anybody who might be struggling, those are some good resources that you can reach out to. You can also get engaged with the community by being a safe person or ally to promote good mental health practices and reduce stigma. You can build diverse partnerships with community organizations, engage in mental health practices and self-care, such as meditation or prayer, engage in meaningful conversations with people who are different from you, keeping an open mind, and engage in healing, not hurtful conversations. So before I move on, I know I've thrown a lot at you guys. Does anybody have any questions? And if you think of any, you can type them in the chat as we're finishing through this presentation. All right, feel free to, interrupt or type in the chat if you think of anything. Okay, so we got 3 more take action steps before I hand you guys your resources and let you out for the day. So take action number 5, helping with sexual health. So having opportunities to receive quality reproductive and sexual healthcare education and access is one way that community members can live happier and healthier lives. So we can do this by joining health advisory councils. If you have relationships with young adults, connecting people to services they might need. From the CDC, educating yourself and others through medically accurate, developmentally appropriate, culturally relevant, and inclusive content and skills that target key behavioral outcomes and promote healthy sexual development. Affirm and promote reproductive and sexual health. Looking for opportunities to share your time, energy, experiences to support pregnancy and postpartum support or emergency preparedness and response information for families. You can attend trainings and educational programs to learn more about sexual health and how it relates to public health, and then join groups and or connect people that you might know with groups such as infertility support groups, infant safety groups, reproductive health groups, depression and postpartum depression services, etc. So there's lots of different ways we can do this. At the end of this presentation, I'm also going to share with you a couple of places that you might be able to get some of this information that I am sharing with you. So before we move on to tips 6 and 7, I just want to know from you. So like I said, mental health is a really important topic to focus on right now. So I'm curious if any of you have anything related to mental health or connectedness that you are passionate about, and how you could use that to help the health of your community, if there's anything you guys are passionate about for it. So for example, for me, I'm really passionate about helping people find services. And so, making sure that, if they are struggling, pointing them in the right direction of some services that might be able to help them. So anybody else have anything mental health or connectedness related that you're passionate about and how you can use it to help the community?
I can share something. So one of my relative is experiencing mental health issues, and then because of the stigma that is in the community, they were not open about it, but that person is struggling. And then because of having access to the mental health resources and education that I have, I was able to help him and point them in the right direction, and that person got treated for it, and now he's living happy.
That is wonderful. Thank you so much for sharing. That is so fabulous. Thank you so much for being a little bit vulnerable and sharing that. I really appreciate it. Anybody else? Okay, no worries. Well, I really appreciate you all sharing and talking through these things with me. We always, what's really great about these classes is everybody lives a different story, right? And everybody has different, resources and roles and whatnot. And so what we experience, our lived experiences, are a great way to help others in the community who might be having similar lived experiences or, completely different lived experiences, and, reaching out. So it's really great to have these connectedness opportunities. So thank you very much for sharing. Okay, taking action, number 6, and then we got one more after this. So helping with rural health. So helping improve the health outcomes for those living in rural areas. So many health disparities, if you remember from earlier in this presentation, we were talking about the social determinants of health. So many health disparities can be present in these areas. Poverty, or food deserts known as food apartheids, environmental hazards, no safe places to be active, less access to healthcare or transportation barriers. Those are all some, some health disparities that might be present in these areas. So when we're talking about how we can take action and help with rural health, like we talked about in the first point, we can help with food access. So like mentioned above, we can volunteer at food distribution programs. We can donate healthy and culturally appropriate and relevant foods. Like we said, we can, grow those gardens and share those fruits and vegetables. So those are just a few simple ways to help with food access. You can also start groups or help people find groups to be physically active together. So maybe starting a walking club. That way, you have, a group of people walking together. So that's one way you can do it. You can promote and connect people with care through digital and in-person formats, such as online classes to reduce barriers. But we do know that some online classes have some barriers, such as, internet accessibility. Then we know some in-person classes have barriers such as transportation. So maybe helping, others find what works for them and their situation and connecting them with the right care or helping them find what they need. You can offer to tutor or teach classes for something you might be an expert in to help with education. You can practice healthy and safe environmental practices, so taking sustainability approaches such as recycling, trash cleanup, biking and biking, walking to work, or doing your errands, etc. So those are some things as practicing safe environmental practices. Assessing your community's needs and resources by talking with the right people, so cities officials, state officials, different departments, maybe like the Parks and Rec department, and engaging with them as well as a diverse group of stakeholders, and communicating and advocating to help make positive change. And then identifying interventions and searching for and applying for funding to try and tackle those needs. Now that's a little bit, it takes a lot of effort, but if that's something you're interested in, maybe in, your earlier time you've done grant writing before or something, everyone has different experiences, you never know, or maybe know somebody who does that. So searching for and applying for different funding to try and tackle the needs that might be coming up in these rural health areas. And then finally, number 7, which I realize I didn't change the title, so this should say take action number 7, helping with accessibility. So accessibility is a major contributor to overall health practices. So being cognizant and inclusive of people who may not speak the same language as you, or might not be able to hear or see, and advocating for credible resources and opportunities to be available in different ways. So maybe that is you're at a doctor's office and you notice there's no Spanish flyers at the doctor's office, trying to find some ways maybe that you can help connect people to help get those translated. Adding closed captioning for presentations. So those are just a few ways of some of the things that you can do. There's way more ways you can do it, but just a few things to kind of get your brains thinking. When you're out in the community, learning how you might be able to modify items or procedures or systems to try and remove barriers to enable all people to use them. So maybe if you are, when you're in areas that you live or work or play or worship and you see that floor spaces hallways might have equipment or things that might be hard to get around, you know, try and speaking with the right people to make sure that we can, you know, make sure that the floor spaces and the hallways are free of those barriers and equipment. Make sure that we provide a space where everybody feels included and where they do have the opportunity to access the needs. Offer time and effort and strategies to connect people with the things they need. So if you've noticed a theme throughout the presentation, there's a lot of connecting people with things you need. There's a lot of different ways we can do that as human beings and with our lived experiences. So really taking some time to get to know people, get to know what they need, and trying to help them. And then improving access to healthy foods, like we have talked about in the many of the other Take Action slides. So with that being said, I know that was a lot, but I am just curious, was there anything in this presentation that you want to do this week that you could do to help improve the health of your community? Even as simple as searching and educating yourself on, you know, some different, you know, where you can get different resources and connecting people. Anybody want to share one thing you want to do to help improve the health of the community this week or next week? Again, feel free to unmute or chat. And if you need time to think about it, that's totally fine too. So if you just need to kind of process all this information that was just handed to you, that's totally fine too. Okay, lovely. Thank you. Continue to volunteer at local pantry to make positive impact in the community. Thank you very much for sharing. I appreciate it. Okay, so where to start? So if you are curious about some of these things and want to help improve the health of your community, a couple of different places in your community can help you with that. So maybe starting with your local extension office, talking with people at the city or your county public health department are some really good places that you can start to talk with some members of the community to try and make some of these positive impacts for the community. So those are some places you can look to and talk to get more information on these things that you might be passionate about. So with that, here are some sources and resources from what we were talking about. I will put this in the summary sheet as well that will be available in the next 2 weeks or so on bronsonhealth.com/classes. So these will be on there as well in case you want to take a deeper dive into some of these things that we were talking about, learn a little bit more about it and what you can do as a community member. So feel free to take a look at those once you get those in the summary sheet or screenshot them or whatever it is that works for you. And with that being said, I just want to say thank you. I know this was a deep class, so thank you so much for attending and sharing and being vulnerable at different points in this presentation. And I hope that this was helpful or gave you some ideas on how you could take action to help nourish a healthy community.
Thank you so much. I appreciate it. And it was very helpful and very informative.
Thank you.
Thank you.
Thank you very much. Have a good day.
Thank you so much. You too. I appreciate you all. Thank you so much for coming.
Have a good day. Bye.
Thank you. You
Bye-bye.
too. Bye, everybody.